Doctor's visits without the drive. Before the pandemic, the Medical University of South Carolina had several 100,000 telehealth appointments a year. But in the first few months of COVID-19, the state of South Carolina saw more than 1.5 million virtual health visits.
It's been vital.
It exploded. It became totally part of what we do.
Telehealth is the use of technology to care for patients over distance, and South Carolina is leading the way when it comes to pushing the envelope.
Here at MUSC, we flipped our visits from almost all your regular outpatient visits happening when you go to see your provider to 2/3 of them happening via telehealth.
MUSC leaders say their hand was forced because the fear of the virus caused patients around the world to not receive proper medical care. The hospital system says telehealth provided a way for the most vulnerable patients to be seen.
My own father, who has some healthcare issues, was able to meet with his dermatologist, which was really important for our family because an exposure would have likely been fatal for him.
It's a life-saving tool for many patients, but has forced medical professionals to adapt to a new way of medicine.
It is difficult and it is unusual. On the other hand, these are well-trained health professionals that can adapt, and they have. And it is different. Your bedside manner is different, what we call your webside manner, right?
We learned how to be creative. We learned how to say, all right, let's zoom in, get really close to the camera so I can see your eye.
The pandemic changing the way medicine is performed, leaving doctors and patients hopeful for future care.
We won't go back to where we were. We don't all know exactly what it means, but we know that more telehealth will be used, and you won't hear insurance companies say otherwise. You won't hear even the naysayer providers say otherwise. They know that something is different and that this is too convenient to ignore.
Telehealth, first used in the 60s to treat astronauts in space, now available to everyone, even in the most remote areas. It has pushed everyone outside of their comfort zone, like the pandemic has done in so many ways. From our News 2 family to yours, we hope this has brought you just a little bit of comfort in such an uncomfortable time. Reporting in Charleston, I'm Danielle Hensley. Count on 2.